This workshop is called Promotion 101, and the objectives of the workshop are actually pretty straightforward. What we'd like to do is to talk a little bit about the promotion criteria. At our school, they're very explicit. The second goal is to just begin to demystify the promotion process and make the process a little bit less intimidating. We'll focus today on clinician educators. We'll talk about the Faculty Promotions Committee. Who are these people who review your dossier and make decisions for or against your promotion? Who are they? What are they looking for? And how do they think? I think it would be a good idea to share some of the secrets about building an effective dossier for promotion or tenure, and briefly just summarize the elements, and also refer you to a detailed guide that's posted on the Faculty Affairs website. Now, you may have additional questions about our promotion success rate. So, for example, what are your chances? 60%, 75%, 85%, or even higher? Maybe it's time to spread some optimism around. And finally, we would usually leave time for questions. Since this is pre-recorded, we can't do that, but we are always open to questions by email, always. So, speaking of questions, some of the things we can address today: is research required at the University of Colorado School of Medicine? Is it required for promotion? And what's up with the clinical practice series? Is it right for me? Are the promotion rules different for faculty at the VA and at Denver Health compared with faculty at the University of Colorado, who are based, I should say, at the university? We always welcome questions that start with, is it true that? Someone told me that. We are always eager to bash some myths and take on the misinformation that's out there, some of the street lore. Like, is it true that teachers can't get promoted? Book chapters and case reports, they don't count, do they? You can't get promoted just with clinical excellence. Is that true? Service doesn't count, or maybe it does. And of course, you're up or out at 7 years if you don't pull this off. And the bigger the dossier for promotion, the better. So just include everything. Now, first, the promotion decision makers. Let me point out that as we get back to the process here, that every recommendation for promotion, the dossier review, the assembly of the dossier, all of that begins within your department. At the front of every promotion dossier is a letter from the Department Promotion and Tenure Committee or the Advisory Committee, as well as the chair. These are the entities, the people that do the initial review of your dossier, and then the department forwards it to the Faculty Promotions Committee. Now, the school-wide Faculty Promotions Committee is the key decision-making body for the school. And just so you know, once the Faculty Promotions Committee approves your dossier, it's not quite done. The dossier, the recommendation for promotion, is referred to the School of Medicine Executive Committee, which is really consists of the department chairs. This is an advisory committee to the dean. And then there's a referral to the provost and chancellor of the Anschutz Medical Campus. The regents weigh in only for tenure recommendations. That's the review and approval food chain. This is my picture of a food chain. And all of this takes really just a few months. By the way, there's really very little discussion at the executive committee or at the level of the provost and chancellor. Really only controversial and non-unanimous recommendations are discussed there. Now, this is the most important slide of all, and it's worth mentioning that our criteria for promotion from assistant to associate professor really can fit on one slide. And this is the slide. To start, let's focus on the traditional academic three-legged stool. Yes, triple threats are lovely, but that's really not how our promotion rules are constructed. Simply put, it is not necessary. And of course, it's not realistic to be a virtuoso, to be totally and completely amazing in every area of work. So at our school, the three-legged school is asymmetric. We have a system of majors and minors. That's what's on this slide, because we understand that different faculty candidates have different interests, different job assignments, and they make different contributions to the School of Medicine. So this is basically this system of majors and minors is the heart and soul of our promotion rules. So here's what's required. Meritorious, which is defined as praiseworthy and deserving of merit, is our lower standard of achievement. And in the regular promotion series, which is the vast majority of School of Medicine faculty, you must be meritorious, at least meritorious in your performance in these three areas: teaching, clinical work, or for non-clinicians, service, and in scholarship as broadly defined. The clinical practice series provides an exception for faculty members who do not engage in scholarship. But we'll talk now again about the typical faculty member who advances as a clinician educator. Meritorious, the lower standard. Meritorious at least in teaching, clinical work or service, and scholarship. And then you must be excellent, outstanding, or of exceptional merit, our higher standard in one area, in teaching or in research or in clinical activity. So keep in mind, teaching does count, and you could advance to associate professor with a focus and with excellent performance in this one area. And you can do that as a clinician as well. You can be promoted based primarily on success as a clinician. So the point is to emphasize again, it's not necessary to be an academic triple threat. Triple threats are welcomed, but it's not realistic for most of us. Just add this point about promotion to full professor. The difference here is that now you must be excellent in two areas rather than just one. So it's important, for example, if you specialize in clinical activity, not to neglect your teaching. Not just for promotion reasons, but for all the other rewards that come along with advancing and succeeding as an educator. So one of the things I need to emphasize, or we need to discuss, is this distinction between meritorious and excellent. That actually is pretty critical. How does one determine it? Well, the way this is done in our school is with the promotion matrix. And there's a separate matrix in each area, in teaching, in clinical work, in research and scholarship, and even in service. So the way the matrix works is there are two columns. And the left-hand column is an example, or it lists examples of a variety of activities that are considered meritorious. So for teaching, for example, in the meritorious column, it lists, and this is taken directly from our matrix, active participation in two or more of the following. He or she presents lectures, coordinates courses, advises students, attends on the inpatient or outpatient service, is a seminar or laboratory group leader, presents grand rounds, and has meritorious teaching evaluations. All of those things would qualify for a rating of meritorious teaching. What about excellent? Great. Look at what is emphasized in blue. Greater than average share of teaching duties, a course or fellowship director, success as a mentor, consistently outstanding teaching evaluations, even teaching awards, development of innovative courses, syllabi or teaching materials, leadership of courses, national educational activities, such as residency review committees and educational task forces. I think what you can see here is the emphasis in the excellent column is on greater responsibility, a larger share of teaching duties, leadership, and impact. I'll just give you a heads up that we're working on some proposed edits to these rules, and I didn't put them on the slide, but the edits are expected to include diagnostic skill and judgment, excellence in the care. Oh, I'm sorry. That's going to come up here in just a minute on the clinical practice. So let me tell you now about the meritorious versus excellent matrix for clinical practice. Let me tell you about that. The left-hand column that's meritorious is active and effective participation in clinical activities of the unit, being board certified, demonstrating highly effective clinical skills, patient satisfaction, support from peers at a practice site, invitations to speak on clinical topics, participation in quality and patient safety committees. You can see some of the examples of excellent clinical practice. Greater than average share of clinical duties, development of new therapies. By the way, documenting greater than average share of clinical duties. Here are some examples as listed here that are from the matrix, measured by patient care, procedure logs, RVUs, or other measures of effort. Development of new therapies, leader of structured projects that evaluate effectiveness, access, cost, utilization, and outcomes. Recognition regionally and nationally of clinical excellence, clinical leadership, national leadership, and then significant involvement in healthcare advocacy, community service, or activities that shape healthcare policy or address health disparities. Again, this language is taken directly from the excellent column. This is what signifies excellent, with a faculty member who devotes a large share of his or her time and effort to clinical work. And I was going to mention some proposed edits. We're planning to, once we get full approval, to add these other dimensions: diagnostic skill and judgment, excellence in the care of challenging patient populations, which could be primary care, surgical, inpatient, reputation as a consultant, and demonstrated effectiveness as a physician or an APP in communication, teamwork, advocacy, and patient-centered care. So this is about effective doctoring, and this has been missing in the matrix, but we hope to recognize it with some with some wording changes. So just the bottom line of all of this is that the promotion matrix is designed to help differentiate meritorious from excellent work in each of the areas. There are specific concrete examples to help with that. This is the key document that guides the members of the Faculty Promotions Committee as they review your dossier. We put it up on the screen at the meeting. It should also be used, and I emphasize this quite a bit, to facilitate active career planning, to help more junior faculty members, perhaps in meeting with mentors, decide on priorities for time and effort, to decide, how am I progressing really? Do I have enough of the activities and leadership roles listed in the matrix in the excellence column to make an argument in the next year or 2 years or 3 years for excellence, for example, in teaching or in clinical practice or in scholarship? There are examples that would be worthwhile, worth our time as we think about advancing through the academic ranks. So in general, a rating of excellent means more than average share of responsibilities, greater breadth, for example, several activities in the excellent column, greater depth, leadership, and documented impact in one or more of these, and that all of these are documented in a promotion dossier. By the way, you will submit a personalized promotion matrix. I'll show you this in just a minute as part of your promotion dossier, and we'll come back to that in just a minute. But this matrix at our school is the critical document in promotion and tenure review. Now, I wanted to talk for just a minute about the Faculty Promotions Committee, the group of your peers that votes for or against promotion. And we actually don't have our own flag, but you may want to know who's on it. And there is a myth out on the street that the Faculty Promotions Committee consists of 5 old, cranky, tenured full professors, mostly male, no doubt, mostly bench scientists and Nobel laureates. Actually, this always gives me an opportunity in Promotion 101 workshops, speaking of tenure, to be sure that you know the operational definition of a tenured professor. So this is fairly worthless material, but I'll tell you that as it goes, the definition of a tenured professor is a professor who was asked to attend a Wednesday lunch meeting and complained that it ruined 2 weekends. So who's really on the Faculty Promotions Committee? We have about 23 members right now, and it's a mixture of associate and full professors. Some are tenured, some are non-tenured by design. Some are employed by the university and others by Denver Health, the VA, National Jewish, or the other core affiliates. It's our job to ensure to the best that we can that the committee includes a balance of investigators and clinician educators. In 2018, long overdue, we welcomed our first advanced practice provider, a nurse practitioner, to the Faculty Promotions Committee. But let me just make a point that despite all of this amazing balance, this is not like a grant review study section. It is very unlikely, despite all this balance, it's very likely that no Faculty Promotions Committee member will truly understand your work, your scientific accomplishments. It's not like it's a group of investigators in your field. There may not be a transplant surgeon on the committee, or a gyne-oncologist, or a geneticist, or a hospitalist. There might not be anyone who understands fully your work, your papers, your contributions, even your specialty. And that's why the emphasis is on documentation in a promotion dossier. That's why we talk so much about dossiers. It is vital, and it's your responsibility and your department's responsibility in a promotion dossier to document the quality and importance and impact and reach of what you do. So the CV, it's essential, but it's not enough. CVs are boring archival lists. They're still critical, but they won't be enough. And when it comes to your impact as a mentor, listing 11 names in your CV is also not enough without any information about the impact that you had as a mentor, your success, their success. Listing your publications isn't enough. That's why there's a section in the scholarship portfolio for an annotated bibliography where you highlight the importance, the reach, the discovery that you made, or the importance of a curriculum that you developed. And the chair's letter, that's not enough either, with all due respect to our chairs. The letter that says, Dr. Lowenstein is a devoted, tireless, inspirational, and highly effective educator, that is not moving to the Faculty Promotions Committee members, absent some evidence that any of that could be true. So dossiers are about articulating in a narrative form what it is that you do and how you succeeded and why it's important, and providing supporting documentation. So the dossier consists of separate portfolios in clinical work, scholarship, and teaching, for example, as well as internal and external letters of support. And we'll talk about this right now, but the point is your dossier has to be convincing to the Faculty Promotions Committee members who, again, may not have in-depth knowledge of your field. So you have to start building a promotion dossier, not in year 6, but starting now, which doesn't mean necessarily tonight. It's just that year 6 and year 7 is too late. So let's talk for a second about dossiers. What are they? When I once looked this up in the dictionary, it said, a dossier is an accumulation of records, reports, and miscellaneous pertinent data and documents bearing on an individual's subject of study or investigations. But then I looked a little bit further in the dictionary, and the next definition was, a dossier is an author's accumulation of notes toward the creation of a projected fictional character. So enough about that. And by the way, none of this is just really a picture metaphor. We don't accept any paper dossiers anymore. So I mentioned to you that the promotion dossier includes portfolios within the dossier. There are separate portfolios in teaching, clinical work, and scholarship, those areas that are relevant to what you do. Now, each portfolio in turn contains 3 elements. One is the narrative. The narrative is where you articulate the range of activities you engage in, why they're important, and the outcomes of that work. You explain it to the Faculty Promotions Committee. It may be in paragraph form, in bulleted lists, sometimes charts. The second part will be an annotated bibliography. That's really for the scholarship section. This refers to all forms of scholarship that you have completed as an assistant professor. And the narrative also highlights the range of activities, as I mentioned, focus, impact, and especially your leadership role. So that's the narrative. It's not supposed to be longer than 6 pages unless it really takes more pages than that, a greater number of pages to fully explain your accomplishments. Narrative is part 1. Part 2 is the personal promotion matrix. I'll show you an example. And part 3 is supporting documents. For example, teaching evaluations. For busy clinicians, it may be clinical performance dashboards that are assembled for all the faculty in your department. So just as an example, let's talk for a minute about the narrative in teaching, which, as I mentioned, 3 to 6 pages is the recommended length. What are we talking about? It starts, and this outline is available to you, and I'll show you where to find it. This outline is available to you. Actually, it's currently in Prism as well. It starts with a teacher statement. This teacher statement is what and how do you teach? What is unique about your teaching? What's important? How do you assess learning? And how has this changed over the past several years? This is all relatively easy if you're reflective, and it's a little harder perhaps if you're just a genetically gifted educator and you don't really think about any of these things. The next 3 sections, classroom activities, bedside teaching, other didactic teaching, mentorship in the lab, these really are the who, what, how often do you teach. They describe the range of your teaching efforts. Novel lectures, I'll come back and show you why that could be important for some faculty members. Then there's teaching administration, course leadership, curriculum innovation and scholarship, the syllabi, the problem-based learning exercises, the simulations, the websites, for example, that you've developed. Studies of learning outcomes that you have been engaged in. The scholarship part is pretty straightforward. Your role as a mentor and advisor, we'll talk in just a bit about documenting that. Outside teaching in CME courses as a visiting professor, courses that you've taken, workshops, seminars, programs that you have signed up for and completed that are self-study aimed at improving your skill as an educator. And of course, teaching awards and recognition. This is the general outline for a teaching narrative. All of this is explained fully in the dossier guide that, again, I'll refer to in just a minute. Now, I mentioned that one of the sections of the teaching portfolio of the narrative section could be about development of novel lectures. So here's 2 examples that these are real from relatively recent promotion dossiers, and they're all listed in the promotion dossier guide that, again, I'll mention. So one faculty member wrote that he or she had developed a special lecture in controversies in prostate cancer screening. Over the past several years, I developed 2 formal 50-minute classroom lectures. The most recent was for graduate students in the Cancer Prevention and Control course entitled Controversies in Prostate Cancer Screening. And the material included an overview of the test characteristics of the PSA blood test, modifications of the PSA to improve accuracy, downstream diagnostic dilemmas in the face of abnormal PSA results, conflicting professional guidelines for screening, and then the challenges associated with counseling patients about treatment, screening and treatment. In a different educator's narrative for promotion, a faculty member talked about a lecture called Race, Ethnicity, and Culture in Biomedicine. I also developed a lecture complemented by small group follow-up discussions entitled Race, Ethnicity, and Culture in Biomedicine with special reference to cancer. I presented this material to 100 first-year medical students. The goal was to upend students' taken for granted assumptions about the meaning of race and to help them identify overly simplistic uses of this concept in the medical literature. Then there'll be documentation that the lectures and discussions that followed were well received. And he or she writes, and informed by this experience, I wrote a chapter and describes again the scholarly output of all of this work. These are examples. I mentioned these, and there are other examples like these in the Dossier Builder Guide. Sure, the lecture, the date, it might be in your CV, but this is where you bring it to life. So my advice is you just can't let these, this is not for all your lectures, but for the ones that you work on this hard and develop and improve over a number of years that are your specialty. You can't just bury this stuff in your CV. So here are some examples of the narration. People ask a lot, how do I write about a course I developed and led? Here's just one example. This was actually a PhD in a clinical department who wrote this. I developed and directed a novel case-based bench-to-bedside course for fellows and residents in gastroenterology. This course emphasized basic principles of immunology, genetics, and molecular science that apply to GI diseases, and it included a critical review of 12 recent published articles illustrating common flaws in using animal models to simulate human disease. One effective teaching tool that I employed was to use quotations from textbooks of gastroenterology over the past 5 decades to illustrate how our understanding of basic disease mechanisms has changed with advances in cell biology, biochemistry, and genetics. And this person went on to describe the number of students and the number of medical residents and fellows who've taken it. He or she provided links to the course objectives in the syllabus, the appendix, which had the teaching, the documentation, supporting documents included course evaluations and the results of pre and post tests. And then to bring it home as a scholarly project, this faculty member presented an abstract describing this course at the Western Group on Educational Affairs, WGEA, for the AAMC. So that's enough now about the narratives. I wanted to tell you a little bit about component number 2 in the teacher's portfolio, and that's your personalized matrix. So this is required in your dossier. I recommend that junior faculty members work on this periodically, not daily, but just periodically over the course of their time as an assistant professor. But again, the goal here is to document, is to link your accomplishments with the requirements, the expectations, the examples that are listed in the promotion matrix. So now these things now are on the left side. The faculty member has taken exactly what's written in the excellent column and put them on the left side so that the faculty member can outline the number of accomplishments that are relevant to that expectation. So one of the examples of excellence in teaching is development of innovative courses, high quality syllabi, novel lectures, PBL cases, laboratory exercises, or other instructional materials, right? Here's what I did. I developed a sports medicine module for residents. I wrote an 84-page evidence-based syllabus. I developed 6 web-based patient encounters demonstrating the knee exam and approach to common knee injuries. That's how the matrix works. Demonstration of educational leadership. Well, I co-directed a multidisciplinary CME course called Sports Medicine for Primary Care Clinicians. I served as co-chair of our department's Medical Student Education Committee. There are more examples in the guide, But this is an example of a personalized promotion matrix. So if you do this and outline the different ways that your accomplishments represent excellence as articulated in our promotion matrix, it ties the hands of the members of the promotions committee. What are they going to do when they see this? Say no. You have documented how you have met the expectations for promotion. And there's a tool that you can use. This is the newer address to the Faculty Affairs website. Easy to find, but under the section of resources for faculty and then assembling a promotion dossier, there's this section called Promotion Matrix Table Templates. And if you'd like to start building a clinical excellence or a teaching excellence matrix, you can just pull it up, save it on your computer. It's just a Word document, and begin to fill in the appropriate information. Edit it as you go along, delete bullet items that are no longer meaningful or important, and of course, add new ones. Now, section 3, and again, we're focusing on teaching here, is the supporting documentation. We talked about the narrative, number 1. We talked about the second component, your personalized promotion matrix. This is the third, providing supporting documentation. So a teaching portfolio must contain teaching evaluations, letters from students or mentees, quantitative scores, any variety of comments that address your teaching effectiveness. Letters from students, residents, and mentees, critical. There's examples of bulleted lists and charts and different ways to document your success as a career or research or clinical mentor. We don't use peer evaluations as often, but they can be very valuable. These are statements that are written by co-faculty members about the clarity and accuracy and effectiveness of your delivery, the syllabi you've created, how you've used different teaching methods, for example. Typically, all these evaluations are assembled in a promotion dossier as an appendix. Now, sometimes the question comes up, should I get letters from mentees? The answer is unequivocally yes. Mentees provide information that no one else really can about your impact as a mentor, how you taught someone research skills or scientific communication, how you served as a role model for ethics, professionalism, how you were a model of clinical excellence and evidence-based practice, communication, humanism, teamwork. I remember still in a promotion dossier, one faculty member included a note from a mentee saying that she was a maestro at leading and supporting the healthcare team. Career counseling, how he or she helped me reach my goals, how he or she helped me learn how to balance work and family. These are just examples of some of the critical information that mentees can provide that supports the argument that you're an effective, skillful, and devoted mentor. People ask all the time, if you have taken on the responsibility of developing and leading a course, a fellowship program, how do you write about that in a scholarly way? In other words, how do you turn that administrative job into educational scholarship? And you'll see examples of this in the Dossier Builder Guide, but here are the elements. If you can describe in your narrative that what were the objectives? What need or gap in the curriculum did the course or program fill? Maybe residents were not, or fellows were not succeeding in this area. What was the content of the course and how was it developed? Tell us about the defined learning objectives and how were teaching methods, what techniques were selected and why? And then what were the results, the significant results, the impact? Who took it? Was it integrated into the curriculum? Was it disseminated? Was it presented? And do you have measures of effectiveness of learning, test scores, evaluations, and feedback? Are there any scholarly products that can be reviewed to make this scholarship? A website, syllabi, videos, simulations, and importantly, What was your role as a leader and creator of this educational innovation, of this new course, of this curriculum? There's an entire appendix devoted to this topic, documenting educational scholarship in the Dossier Builder Guide. Now we've used to show you, to help you understand the structure of the dossier. We've been talking about teaching, but let's just mention briefly the clinical portfolio. And the narrative, again, 3 to 6 pages, typically includes a reflective statement, a description of the scope of your clinical work, the types of patients, the procedures, the unique challenges, whether it's in primary care or critical care in the MICU or a subspecialty, any clinical innovations or special expertise, your role as a practice or administrative leader, your role as a clinician educator. Yes, it's true, you can double dip and talk about this both in your educators as well as your clinicians portfolio. Your leadership, significant involvement in activities that promote patient safety, quality improvement, the health of populations, and that address health disparities. This is similar to the language you just saw in the matrix, right? Clinical scholarship, which could be case reports, review articles, pathways that you've developed and are perhaps used and accepted nationally, and regional or national service. So just to show you 1 or 2 examples of clinical work narratives, one person wrote, "The focus of my clinical work and scholarship has been the development and evaluation of tools to ensure that national guidelines for hypertension and diabetes care are adopted and adhered to in this indigent care internal medicine practice," followed by further documentation. Separately, a pediatrician wrote, "As co-chair of the Children's Hospital Effective Antibiotic Use Task Force, I led efforts to develop the institution's evidence-based recommendations for management of colds, coughs, and bronchitis in outpatient settings." And again, what would be described was impact in the narrative. What was the context, the needs assessment, a clear statement of the project's goals, what intervention was developed, guidelines, pathways, with whom did we collaborate, how was the evidence gathered, did we implement and disseminate, what were the outcomes and impact, and the faculty member's leadership role. Perhaps you're writing, for example, about an interdisciplinary stroke pathway. You would describe your work in all of these areas. And maybe the outcomes and impact would have something to do with greater adherence to thrombolytic pathways and evidence-based guidelines, or perhaps more proper pre-treatment risk assessment. You would document this for the Faculty Promotions Committee members to appreciate the impact and the seriousness of this work. I won't talk to you about in detail about the scholarship portfolio, but basically, whether you're a scientist or your work is in clinical scholarship or you're a teaching scholar, there's an outline that will help you narrate the focus and importance of the scholarly work that you have done. So I've referred a lot to the guide to the promotion and tenure, the guide to preparing a dossier for promotion and tenure. We have a new updated version, but this one really is still valid. All of the information is still applicable. The advantage of this, and it's posted on the website, this again is the website address, it has examples of narratives about teaching and clinical work that demonstrate impact and outcomes. Examples that will help you document your mentoring success in the form of charts and bulleted lists, the documentation that you need for course leadership, examples of narratives about your scholarship, examples of annotated bibliographies that help you highlight the importance of a chapter or of a review article or a scientific paper, and examples of personalized promotion matrices. So sometimes people ask, are there documents not to include? Yes, of course. So reprints of original articles, these we wouldn't accept now anyway, and people don't usually get reprints, but it's possible to include links so that interested faculty promotions committee members can review papers if they wish. Course syllabi, typically you should only be providing a link to those. And syllabi should have content if you're going to link to them, not just be a schedule of lectures, for example, or a calendar, or even a table of contents. No one will accept lecture notes and PowerPoints. These are not scholarship, and these are not important for, and it's not possible or practical for faculty members to read and judge them. Announcements of lectures and meeting agendas, it's better to simply list that you were the plenary speaker at a meeting of the American Heart Association, but no one in the review committee really has to see a copy of the meeting agenda. Copies of awards and copies of CME certification are also not helpful. And we advise limiting the number of emails and letters from colleagues, patients, trainees, and others, including those that are substantive. So remember that your goal is to be informative. You want to inform and persuade the faculty promotions committee, but not be super annoying. I want to remind you that when it comes to scholarship, our school defines it quite broadly. Remember that in the regular promotion series, not the clinical practice series, but the regular promotion series where most clinician educators reside, work, and are promoted, you must be meritorious in scholarship, and for full professor, excellence in scholarship. And the 4 types are listed here. Traditional research is the scholarship of discovery, but we also accept and welcome and reward educational scholarship. We've been talking about this really innovative curricula, PBL cases, simulations, course leadership, novel instructional methods. The scholarship of application includes projects that improve the health of patients or populations, such as quality improvement reports, reports on outcomes that improve patient safety or address healthcare costs and value, development of evidence-based pathways, health disparities projects, and public policy white papers. The last category is the scholarship of integration. This is often clinically relevant, but it includes review articles, chapters, case reports, editorials, and more recently we've come to recognize works in the arts and the health humanities. So these are the 4 categories of scholarship. All are welcome: discovery, education, application, and integration. These are sometimes called alternative or non-traditional scholarship. They are now traditional and welcome at our school. So the point to emphasize is that our definitions, our promotion rules and our scholarship definitions are broad and accommodate almost anything in medicine, science, writing, public health, ethics, quality improvement, education, health services, policy, community outreach, and the humanities. What's required in every case to call it scholarship is products, written, electronic, products that can be reviewed. So just to give you an example of the scholarship of teaching, these are just some more recent examples. A faculty member was credited with scholarship for computer-based simulations that were used widely to teach and assess cricothyrotomy, thoracotomy, and other procedural skills. In another department, a faculty member demonstrated scholarship by developing innovative competency-based curricula for residents that focused on end-of-life care, pain palliation, and spirituality. Another developed an educational manual for students and residents focusing on the principles of caring for uninsured patients in homeless and indigent care clinics. And keep in mind that earlier slide that outlines how you describe this in a scholarly manner. The gaps in the curriculum that were addressed, the content, the methods of teaching, the outcomes, why it was important, who learned from these teaching efforts. So just a couple more things to cover. Getting back to some of the myths I referred to earlier. There is a myth, I just wrote it here, most assistant professors don't get promoted, at least not on the first try. We're all born losers. We're drowning in our frustration, AKA we're mostly just epic failures. Well, really, here are the data on the promotion and tenure approval rates at the University of Colorado School of Medicine for the past 18 years. If you look at assistant to associate professor, 1,500 dossiers have been reviewed. The success rate, the approval rate is 98%. You might say, but that's not true for clinicians. Even in the clinical practice series, well, it's 99%. It's the same. The success rate of going from associate to full professor is 96%, and applications for tenure just a little bit lower at 92%. Now I recognize these seem and are inflated. These are numerators. These are success stories. These are people who have continued to work here, have stayed as faculty members in our school, and have had their dossiers submitted to the promotions committee. But these are very, very high numbers. So maybe it really is time to spread a little optimism around. Just a couple of last things. People ask, when should I start? Well, the answer is to prepare and plan for promotion early. That is not at year 6 and not at year 7, because this is a continuous process. What I recommend is that faculty members discuss their promotion progress during annual reviews with their chair, and definitely during the mid-course comprehensive review as an assistant professor in years 3 or 4. But even in the annual review, I don't think that the annual review should be limited to just the chair handing you your grades and you humbly receive them. There should be talk about the promotion matrix, your accomplishments, where there's a gap, what you need to do, what makes this career that you've chosen rewarding, and how will you get recognized for your most important accomplishments. The mid-course review really is a mock promotion dossier review, and you should be assembling a draft dossier, and you will get written feedback about gaps, areas of strength, your general overall readiness for promotion. I advise reading the promotion rules, especially the promotion matrix and the dossier builder guide. As far as the promotion matrix and these rules, the faculty promotions committee members have read them. You might as well read them as well. Prepare and update your narratives, not daily, not monthly, but frequently during the course of your time as an assistant professor. The narratives that will help you describe the importance of your work as a clinician, investigator, mentor, educator. Prepare and update your promotion matrix in teaching, scholarship, and clinical practice, and think about internal and external letter writers. Who might you and your department turn to when it comes time to assembling your final promotion dossier? So my overall recommendation really is to think about promotion frequently, but not obsessively. And my operational standard for what's obsessive is this. If you go home, every day is too much. It's like if you go home and your partner or kids say, "How was your day today?" And you say, "Well, today was only meritorious, not excellent," then I think, in fact, you've probably gone too far. So that's all we can cover in this Promotion 101 workshop. I hope we can meet in person one day soon. In the meantime, please email us with questions, and of course, visit the Faculty Affairs website, where you'll find a variety of resources, all of them focused on promoting faculty success. Thank you so much.